Good morning and thank you very much for joining us. I am Yori Folarin. We're starting off today over in Delta State, where the governor, Dr. Nwoko, has been, expressing appreciation to the federal government for, a program, the Covid-19 Action Recovery Stimulus, NG Cares, and that's a program for micro, small, and medium enterprises that have been impacted severely by the pandemic, to sort of provide them with succor. Now, in Delta State, they're taking this quite seriously. As I said, the governor was expressing appreciation to the federal government for launching it, and the Delta State government has picked it up, robustly, shall we say. And to tell us about that and explore it is Dr. Michael Nwoko. Dr. Michael Nwoko will be joining us remotely. He is SSA to the Delta State Governor on Health Monitoring. Dr. Nwoko, by the way, among many other achievements, is a fellow of the Royal Society for Public Health in the UK. Good morning, Dr. Nwoko.
Good morning. Thank you for having me.
Indeed, it is our pleasure. I see that the governor is quite enthused of this initiative of the federal government, right? And is keying into it. Tell us about it. It's a World Bank federal government kind of a program, but please tell us what we need to know about NG Cares.
Yes, I'm supposed to speak to you with respect to how Delta State is combating COVID-19, but
well, okay. No, I'll take that as well, Doctor. I'll take that as well. But I just noticed that your governor has been, singing the praises of NG Cares. So I thought maybe we could start with that. I'd like to hear very much what you in Delta are doing to combat it. Please take your time, Doctor.
Yeah, yes, that's okay. So you want me to talk about the recent empowerment program that was launched by His Excellency the Governor before we go into the COVID-19 situation? There is okay. His Excellency the Governor is one who is in a hurry to bring about unprecedented development in the state. He has achieved a lot, especially in the area of human capital development. He is one who wants to create wealth for all residents of Delta State, and who have been getting tremendous results since he came on board as governor in 2015. That's the first tenure, where he brought about melodramatic changes and actually affected all the sectors of the economy of the state. And so Deltans came together to say, yes, that the governor has done so well, he has performed relatively well, and of course it's important for him to be given another opportunity to be able to consolidate on the smart agenda. Now we're looking at the stronger Delta agenda. So what you are seeing today is encapsulated in the stronger Delta agenda of His Excellency Senator Dr. Ifeanyi Atokowa, wherein the administration is totally determined towards creating wealth, towards ensuring that they make a lot of youths who are currently in the unemployment market to be entrepreneurs. And of course, he has been able to address their funding for businesses, little businesses, etc., so that they can become entrepreneurs and grow over the years, and also mentor other youths, etc. This has a lot of impact on the economy, of the state, because it's really opening up the economy of the state, wherein the people are now becoming gainfully employed without necessarily having to wait to be employed in the state government workforce. Is also a way of creating wealth. So His Excellency the Governor is doing so much in other sectors of the economy of the state to be able to effectively actualize the stronger Delta agenda of this administration.
Well, thank you, Doctor, for that overview. That really concerns it's all over Nigeria. This is about how Delta State is engaging with it. Now let's go to the main thrust, so to speak. That is your efforts at combating the COVID-19 pandemic. it has this unfortunate, especially now we're talking about the Delta variant. It has nothing whatsoever to do with Delta State, but then Delta variant is the Delta variant. It's supposed to be a more virulent one. Now, what would you say, Doctor, is the main thrust of your campaign against COVID-19 in Delta State?
Yes, if you followed up the COVID-19 battle since the first wave of the pandemic, that was sometime in March, April of the year 2020, down to the time that Delta State recorded its first, its ended case of COVID-19, you will agree with me that a lot really was put on the ground. As His Excellency the Governor, through the State Ministry of Health, activated the state's public health team that is charged with the responsibility of responding. That is the emergency operation center for COVID-19. We just came out of the Lassa fever situation before COVID-19 struck, and so we have had the structure on the ground, and so the same structure was respond to the COVID-19 situation. And since then, the state has actually been ahead of other states of the nation when it comes to such response. We had lockdown, etc., and other stringent measures were put on the ground in order to effectively contain the COVID-19. And before you know it, in no time, we were able to flatten the curve of COVID-19, which is a major outcome of the efforts that we made, all the department of the operation of the COVID-19 team in the state, right from the task force, COVID-19 task force, the central committee, down to the incidents team, down to the management team, down to the contact tracing team, etc., disease surveillance officers, etc. We had all departments of the operation working tirelessly, and by God's grace, we were able to flatten the curve before we eventually had the second wave. The second wave didn't have much of impact because at that time, we were equally combat ready with our response, etc. And then we had we are currently in the third wave of the COVID-19 situation, and God being so kind. During the first and the second wave, we were focusing more on the non-pharmaceutical measure towards containing the COVID-19 situation, and that is for the people to adhere strictly to preventive protocols such as compulsory use of face masks in the public, regular washing of hands with clean water and soap, or use of alcohol-based hand sanitizer, social distancing factor, etc. So
Doctor, could I just come in there, Doctor?
Yes.
I wonder what your impression is of how well the citizenry in Delta is cooperating with this advice, because as you know, globally and indeed nationally, there seems to be some kind of some people are calling it fatigue. People are sort of relaxing, refusing to put on the masks, ignoring advice such as you're just mentioning about correct socially distancing. What's your experience of the attitude of the people of Delta State to these advices and recommendations?
Yes, we had this challenge of hesitance on the part of the people to comply with the non-pharmaceutical intervention towards containing COVID-19. So what we did was that we didn't rest in our hours. We continued the work we were doing towards ensuring that we drum up this advocacy and sensitization campaign on the need for the people to comply effectively with this non-pharmaceutical intervention. But currently we are in the third wave of the COVID-19, and shortly before the third wave, God be so kind, the vaccines for COVID-19 were developed. And of course, that brought about real pharmaceutical intervention towards containing COVID-19. So the situation we are, calls for driving this sensitization and advocacy for the people to actually take their vaccines. The vaccination program was segmented into phases. Of course, we successfully rounded off the first phase in the early parts, of the year, towards the middle of the year. And of course, we are currently in the second phase of the vaccination program. We began the second phase of the vaccination program in Delta State precisely on the 26th of August, in 2021. And we received not only the Oxford AstraZeneca vaccines that we only utilized during the first phase of the vaccination program, but at this time we also received the Moderna vaccines to be able to help encourage and drive the vaccination program. You see, we are equally faced with a lot of resistance on the part of the people.
Okay, because I was going to ask that, Doctor. I'm happy you went there. I was going to ask what the Delta experience is with those who are declining to take up the offer of a vaccine, and worse still, the conspiracy theorists, what effect they've had on the people of Delta.
It is really very unfortunate that at this time, wherein we are recording so much fatalities on account of COVID-19, we still have a situation whereby some persons, including some educated persons, propagating these conspiracy theories. It is very, very unfortunate, and it is highly ridiculous. COVID-19 pandemic has led credence to the death of millions of persons globally. And a large number of persons have died on account of this virus in Africa and in Nigeria. And people are still dying. How much more persons do we need to die in order for us to take our vaccines?
Yeah.
People will tell you that it is a ploy to inject microchip into the human body in order to monitor the human race. This is ridiculous. Inject microchip into the human body with a needle? With a needle? For God's sake, we have had vaccines in this world over the years. You and I took the polio vaccine when we were much more younger. You and I took the measles vaccines when we were much more younger, in order to guarantee our protection against these diseases. And today we are being protected, and that's the reason why Africa and Nigeria have been declared polio free, because of the vaccination program. This is just a routine vaccine, just like any other vaccine. Even when the vaccines arrive in Nigeria.
But Dr. Nwoko, I'm sure you can appreciate part of the reasons so-called for the dissenters, let me just refer to them as that. They are querying that every man of science knows that it's a Herculean task to develop a vaccine, and it takes decades. But they are highly suspicious, according to them, of the lightning speed, relatively speaking, with which this COVID COVID virus has been developed. And so they say there's been so much cutting of corners that ordinarily scientists would not stand for, and so they are suspicious. That's their case in a nutshell.
No, you don't expect scientists to record achievements, scientific achievements with same speed, today as they recorded in the past. It is not possible, because we have modern technology, we have a lot of nanotechnology, this era of nanotechnology, genetic engineering, etc. So it is not possible for there to for scientific process, to maintain same speed as it maintained in the past. It is not possible. And you don't expect scientists to fold their arms and be watching people die. Millions of people die all over the world, and you expect them to fold their arms? No. They took the bull by the horns, and they worked 24 hours in the laboratories in different parts of the world, just ensuring that vaccines are developed.
I suppose that's also an important. Sorry, doctor. Sorry, doctor. I suppose that's an important point, that all scientists, all laboratories, all researchers around the globe were focused on this one problem, and therefore that probably would have gained us some economies of scale in terms of the speed with which you could deliver. I don't know.
A quick possession. Yes, of course, that's exactly the point I'm trying to drive here. They focused on it because of the devastating effect of COVID-19. And let me tell you, COVID-19 also came and tested institutions, viable health and economic institutions all over the world. And you don't expect people to fold their arms because of the devastating effect of COVID-19. Now, let me even tell you, even at the time that we were driving, this advocacy and sensitization for the people to adhere to the non-pharmaceutical measure. That was before the vaccines were developed. Many persons were praying that they would rather prefer to take vaccines. Now the vaccines are here, and some also have reasons and have cause to doubt the same vaccines that they prayed to be developed in order to be able to guarantee their protection against COVID-19. Come on, it is important we face reality here. We must understand that no one has a right to affect anyone with COVID-19. And because we are in the era of healthcare globalization, we are in the era of institutionalism, we are in the era of multilateralism. People move from one region of the world to the other. And so no one is safe until everyone is safe.
Yeah, we've heard that.
That is the point. So people must understand. In fact, the situation we have at hand is, a different variant, a new variant, completely new variant. You talk about Delta variant, you had the Mu variant, different variants are springing up among the unvaccinated population.
Yeah.
And when these new variants are out there, it will even become a threat even to the vaccinated population.
You know, Doctor,
that is what the people must understand.
Well, Doctor, people are saying that in Africa generally, and yes, Nigeria is part of that, it's been surprising to scientists around the world how relatively lightly we have been impacted with this epidemic, considering, the fatality rates in the West, in Europe generally. People expected that because of our, relatively moderate development compared to those scientific nations, that people were going to be dropping like flies. But it didn't happen that way. And now they are pondering, what is going on here? Africa was supposed to be comatose now, but it's not so. In this connection, you would be able to help me with the latest, what are the figures you have for, for COVID-19? How bad is it?
Yeah. Yes. You see, the point is that we do not need to, wait for us to die, for us to record much fatalities on account of COVID-19 before we consider taking our vaccines. We don't need to wait. For the fact that in the past there have been this postulation that in Africa there is going to be much fatalities, etc. Yes, such postulations came because of our healthcare system in Africa, because they know that if the pandemic is allowed to thrive in Africa the way it's thriving, in other parts of the world, we would not have that capacity to be able to contain it because of our healthcare system. Okay, so that postulation was on that premise and perspicuity. You understand the point I'm making?
Yes, I do.
But again, we do not need to wait, because you see, the COVID-19 knows no bounds. It knows no bounds. Now, like I said, the new variants are coming up. They are on rampage among the unvaccinated population. And if you look at the global, statistics of, the vaccination program, for instance, Africa has a population of about 1.3 billion people, and just about 3% of that population have been vaccinated.
Yeah,
that is a huge problem.
That's a problem.
Now, the United States has about 55% of its adult population fully vaccinated. The United Kingdom has about 80% of its adult population fully vaccinated. And just about a week ago, they began the booster doses, etc. And of course, vaccination for the younger people between the ages of 12 and 15, etc., in order to guarantee protection of their people. But there is a huge problem. When you are doing all that, in fact, Israel had already attained, herd immunity. Okay. Now, no matter how much the West does its best in order to guarantee the protection of its citizens against COVID-19, if the poorer nations, if the vaccination program is not effectively driven in the poorer nations, especially in Africa, now more variants of this virus, okay, will come up.
One moment, Doctor. I beg your pardon, Doctor. I've got to interrupt you.
They will even come back to haunt, the West, the developed countries.
Indeed. I'll come back so you can elaborate on the point. But okay. Benedict in Port Harcourt has been waiting to join the program. So I'll come straight back to you, Doctor. Good morning, Benedict in Port Harcourt. Thank you for holding on all that while. Did I lose Benedict?
Kennedy.
Oh, Kennedy. I'm
Yes,
so
Kennedy.
sorry. I wish I could hear properly.
Right, it's very good. Good morning to you, Mr. Yori.
Good morning, sir.
Yeah.
How are you, sir?
Very well, thank you.
Please, there's Kennedy.
Yes, we got that. Kennedy, yes.
Yes.
Go ahead,
Now,
please.
there is this. I want to do us a reminder. I don't know if this has anything to do with the program or not. Please help me out.
Okay.
Now, before the advent of COVID-19, we have our own in-house issues with Lassa fever and all the rest. But I happen to be on the know that immediately this COVID-19 came in. Maybe it came because it came in from the Western Shores, I don't know. We seem to have forgotten that we have an inferno raging inside our house already that has to do with Lassa fever, smallpox, and what have you. I can't remember the last time I heard anybody tell Nigerians what has happened to that issue that was pending before the advent of COVID-19.
Okay.
Now, have you taken the time to go to our IDP centers, Mr. Yori, and see what is going on there? Now, if at all precaution is meant to be taken by this COVID-19 thing, are you not sure it is supposed to start from such areas? But believe you me, nothing, I mean absolutely no attention is paid to such mega crowded establishments like IDP camps.
Oh, okay. Kennedy, I want to thank you for calling in with this point. Thank you very much. I know there is a bit more that you wanted to say, but it's a fine place to present it to Dr. Nwoko. Give me your thoughts on the very idea. He's talking about IDP camps, but he's also making the point that this might have just swept everything we were working upon in terms of infectious diseases off the table in favor of COVID-19 and leaving us vulnerable in those regards. You did actually start by saying that there are some of those issues that you have got to grip with. Speak to Kennedy's concerns.
Yes, I totally agree with Kennedy, and I appreciate his concern. You see, it's important that we are all corporately involved in this process of ensuring that we have or create a healthy society for us to live in, because if we do not have a healthy society, it's going to affect all of us, no matter how much we protect ourselves. Okay, the world is a global village, etc. You must be concerned as to what is happening around your neighborhood, within your family circle, etc. So well, I'm speaking more as to what we are doing in Delta, but I know that in Delta State we're on top of every situation. When we had Lassa fever in Delta, we activated the emergency response team. They swung into action, and we were able to get results. Even midstream, in between the first wave and the third wave of COVID-19, we equally had an outbreak of yellow fever in Delta State. We moved in, we were able to deal with the situation, etc. And so that is an indication, a very strong indication, that Delta State is very much ahead of other states of the Federation when it comes to infectious disease control. But I can state here without fear of contradiction that if other states of the Federation are doing precisely what Delta is doing when it comes to infectious disease control and prevention, I believe we'll have a much more healthy society to live in. So wherever it is that these IDP camps are located, that is really of utmost concern for Kennedy, I believe that the government order in that society should be able to swing into action towards activating their respective emergency response team, etc., to be able to deal with the situation, because this is the only way you can guarantee the health indices of your area, and ultimately guarantee the health of the people. And I believe it is one of the statutory obligations of the government order to be able to guarantee the safety and health of its citizens.
Okay, one moment, doctor. Let me bring in Mr. Adeyi, calling in from the state of Osun. Good morning, sir. Go ahead, please.
Good morning. Can I go ahead?
Yes, please. Go ahead.
Okay, good morning.
Good morning.
It's been nice listening to you and the doctor.
Okay.
However, I if my memory has not failed me, this COVID-19 is well over 2 years now with us. And up till now, Nigerian doctors, the researchers, they have not found anything, single thing to add to what these Western people told us is, the rules to follow. Other than covering the nose, all these
social distancing, washing your hands,
and all this, and even the vaccine. You mean for 2 years now, nobody ever sat down in this part of the world to say, okay, this is what we can do in our own case, except and when we hear them do it this way, that is when we do it the way they are telling us. Don't we have the duty here as in attacking this thing or in our own way? It's worrisome.
Okay.
I always wait on them.
Okay, Mr. Adeyi, thank you very much for calling that point in. So, Dr. Nwoko, what do you think? Chinese medicine, for instance, has been going on for thousands of years. We also have our own systems. How do you respond to the criticism of Mr. Adeyi that we're not bringing any of our own knowledge to the table in this regard at all?
Yes. Well, I think he made a very valid point. There has been this concern as to the input of Nigeria and other African nations in this COVID-19 fight. Yes, I know that we have a lot of limitations, and you'll agree with me that in the beginning of this program, we dwelled on the limitations of African countries to be able to deal with public health crisis of this nature. Okay, but again, I believe that we have fared well, given our the status of our healthcare delivery system, and of course our healthcare system. It's really pretty not easy. You followed up the Ebola situation, and of course the strategy that we adopted. Ebola was not a global pandemic; it was just endemic, within Africa, and we were able to deal with it. And of course, Nigeria was declared Ebola-free by the World Health Organization and some other nations in Africa. We dealt with it, etc. So it is not an entirely a bad situation when it comes to our ability to respond to public health crisis of this nature. And you agree with me that Nigeria is highly rated when it comes to COVID-19 response. Nigeria is highly rated because we did a lot, and we are still doing a lot towards ensuring that we guarantee the protection of our people, against COVID-19. Okay. Now talking about our own input when it comes to production of vaccines. Yes, because of our limitations, we may not be able to. We will not have been able to achieve success in that regard. But I'm aware from the information that we're monitoring that efforts have been made by virologists and through research laboratory, etc., in Nigeria and different parts of Africa to equally impute in that regard. But again, let's also understand that when these vaccines arrive from the West, before they are distributed, they go through NAFDAC screening and approval before they are distributed for use within Nigeria. Yeah. That is equally a way of making input, because if NAFDAC if they do not have the technology, the wherewithal to do that, I don't think they would be able to certify vaccines for our use. So that in a way is also an input from an agency or government in Nigeria. So I think we should understand that our healthcare system, even though yes, we have not yet attained El Dorado, but it is not entirely a bad situation.
Okay, and I want to thank you very much, Dr. Michael Nwoko, telling us about the situation in Delta State, your thrust in combating COVID-19. And as we started off, Delta keying in, as every state can, to the federal government's NG Cares, which is the COVID Cares is an acronym for COVID-19 Action Recovery Stimulus for tiny businesses, small businesses, and even medium-scale businesses that have been impacted by this scourge. I want to thank you very much, Doctor, and hope we can speak with you again. All right.
Well, let me once again thank you for having me, and also thank you for the effort you are making towards supporting us in this drive for the vaccination program. And let us please, for the unvaccinated population, let us get vaccinated. Together we can stop COVID-19. Thank you once again for having me.
Dr. Michael Nwoko.